Hello, my name is Renette from Nursing Tutor Network. At Nursing Tutor Network, we provide tutoring for nursing students who need additional assistance to help them pass their classes. In addition, we offer NCLEX review for nursing graduates who are getting ready to sit for their board exam. Today, I want to discuss thoracentesis with you. What is thoracentesis? What do you need to know about the procedure? Thoracentesis is an invasive procedure where a needle is inserted through the chest wall to remove fluid or to remove air from the pleural space, usually to help ease someone's breathing or to inject chemotherapeutic agent within the pleural space. This is a procedure that can be done at the bedside. However, an X-ray needs to be done first to pinpoint the exact area where the needle needs to be inserted. What do you need to do before the procedure? Before the procedure, as the nurse, you need to make sure you get a set of vital signs on your patient. You also need to make sure that there's an informed consent that is signed. Because this is an invasive procedure, the patient need to understand what's about to happen, and also the patient need to sign the consent. Your patient may be positioned in a sitting position. The patient may be sitting to one side or maybe sitting and leaning forward over a pillow. You want to make sure that the patient knows there will be a local anesthetic applied to the area where the needle will be inserted. Make sure that everything that will be used for that procedure are sterile, and also make sure there's no contamination happening because this is going inside the person's body. You do not want to bring bacteria inside the person's body, so we have to make sure we follow strict aseptic technique and we handle all equipment that are going to be used for the procedure properly. After the procedure now, you want to make sure you assess the respiratory status of your patient. You also want to make sure you listen to the lung sounds. You want to report any changes in the respiratory status of the patient to the provider right away. If there's any difficulty breathing, if there's any increase in the respiratory rate, so the provider needs to know right away. You want to apply a you want to apply a dressing. It's a pressure dressing over the site because there's always that possibility for bleeding, and you will be monitoring for bleeding as well. You want to monitor the client for pain. Remember, they just inserted a needle to the chest wall. So the client may be in pain, and if there is pain medication ordered for the client, you need to administer pain medication if the client asks for it. If there's no pain medicine, you may want to call the provider to get an order for pain medicine for that particular patient. As I said before, you want to monitor the site for bleeding. You also want to monitor for any sign of infection. That was written. Our number is 954-825-6063. You can also visit our website at nursingtutornetwork.com.